Okay, I'll not dwell much on introduction, that has already been done. And like already said, this is a continuation of the presentation concerning the model that we are actually working on in Provincial General Hospital. And my role will be to present data that we have actually had in the last 5 years. And like we said, there's a lot that has been done in terms of SGBV services in Kenya. There's a lot of awareness, there's a lot of media coverage about it, there's a lot of legislation which has come in of late. And looking at it and the model of integration which we are providing at the Coast General Hospital, we are able to look at the data present and also look at the trend. Has there been an increase in terms of utilization of services? Is there a trend in specific groups like children or adults? Is there a change over time? And basically I'll be able to take you through that. This data looks at it from the year 2007 when it was introduced to August this year. And over that period, we have been able to see 3,064 survivors in our unit. That translates to around 50 survivors. That is around 600 per year. It's important to note that since it was incepted up to now, the trends in data which I'm going to present, we actually expected that with increased, maybe with improvement in legislation, with increased awareness, and also with media campaigns which have been going on, awareness to the people, then we expect maybe a rise in various populations. But you'll actually be able to see that despite that, as much as we are integrating these services, uptake of services is there, many survivors are coming in, but the trend has actually remained the same in various age groups as we go on. This looks at the survivors proportion by age from the year 2007 to the year 2012. And from looking at this, you'll see that majority of survivors coming to our units are children. Mombasa is the second largest town in this country, and it's a major town that also looks at the wider coast region, which has a big population. In terms of numbers that we're seeing at our center, up to around 55% are under 15 years. Only around 20 to 25% above 18 years, and another 20% to between 15 and 18 years. So the bulk of the survivors that we are seeing are children who are presenting to our unit. In terms of age, and this also looks at, when you're looking at age between the various sets, and at the same time the years over, from 2007, it's actually remained the same. You cannot actually say that over the years maybe there's been an increase in the number of survivors, either being children or adults, but it has remained the same, and children being the majority. But also, those are given as percentages, but also in absolute numbers. The figures has always remained between 550 to 620 per year. So there actually has been no rise over the years from 2008 to 2012. So looking at that, there has been no significant trend in the increase in cases of any age group. Hence, there's no reason actually to say that over the years, maybe there's going to be a certain epidemic of child abuse, because we are looking at the figures which have been coming to our unit. But the striking element is that from the time of inception up to now, children have been the majority, forming up to 55% of the cases that we are seeing. This is actually in line with many public facilities, although it is in contrast with private setting where we get majority of the data being for the adult population. In terms of gender, actually in many cases we have always thought that gender SGBV services actually affects more of women. But when you look at it in the terms of what we are seeing, overall in general, 83% being female and 17% being male. But when you look at it in terms of age groups, even when you look at 15 to 18 years, and then 18 years above, generally around 20% have been male, and then 80% have been females. There's been no marked difference. Below the age of 15, we find that 23% of them have been boys, and then while around 77% being female, but above ages of above 15 years, 91% have been female, then around 9% having been male. In terms of offense, you're looking at the type of offense, definitely given that 56% of them are children, then basically it means that majority of the offense, the major offense is going to be defilement. So since 2007, all through to 2012, actually defilement has actually comprised the biggest offense that has been there, followed closely by rape, then come to others like attempted rape, sexual assault, then defilement, then sodomy. And basically that's rape and defilement and sodomy, that's penetrative sex, including attempts, make out the bulk of the offense that we are seeing at our center. That's contributes to around 86%. But of striking, most importantly, in the next slide, we are looking at, for those who presented to our facility, and these specific questions, do they know the perpetrators? Because this has a big implication on terms of legal justice, because we are actually trying a model whereby all aspects, after having integrated services, at the end of it all, as much as a medical social issue, at the end of it, the survivors have to get justice. Up to 3/4 of perpetrators are known to the victim. And to expect that this being given the case, then most of the survivors are going to get justice. Because at the end, one of our presentations is going to look at access to justice. But we realize that 3/4 of them, of the victims, the survivors are known. Majority being neighbors, there are a few percentage being relatives, either friends to the father, or friends to the other children in the home, intimate partner, then only around 26% being strangers. So in summary, children actually form the bulk of survivors that we have seen over in our model that we are doing in Coast General. In terms of trends, it has actually remained the same over the years. There has been no increase in terms of, like you said, there's a certain increase in a specific age groups. 1 in 5 survivors are men and 4 being female. Rape, defilement, and sodomy actually comprises around 86% of the survivors that we see in our unit. And above 74% of populations are known to the survivors. Thank you so much.